Hello, I'm Dr. Charlotte Woodward from River Aesthetics in Lymington, and we are a centre of excellence for thread lifting. Today I'm going to show you how we perform a lower face PDO thread lift. This is Pam, my patient, and if you'd like to tell us what you'd like me to do, what are your concerns?
Yeah, I've got quite a sagging lower jowl here. This really bothers me. So recently we did some Botox to lift this area, and that has made a difference.
Yes, what I've done so far 2 weeks ago is I put some botulinum toxin into Pam's masseter muscles just to narrow her jawline to give her more of a heart-shaped face. And then today we plan to put some PDO threads in to give her some lift. And then the next stage of her treatment would be some filler in the mid-face to give her some volume back from where she's lost her volume. So now I'm going to show you where I mark Pam up before she has her procedure. We mark the threads where we're going to put them down to give her the most lift. The threads are put in through a small hole here with a blunt cannula so you don't get trauma to the tissues. Right, so what I'm going to show you is where I've just marked where I'm going to put the threads. These are the vectors where I'm going to insert them, and you can see if Pam turns towards the camera we get a nice amount of lift where the threads are going, and that's what we're aiming for with the threads once they're inserted. So I've just put some local anaesthetic into Pam's face, ready to make the small incision point to put the threads in. How are you feeling?
Yeah, fine. Can't feel anything. Thank you.
So now I'm going to make a small incision point where the blunt cannula goes in. I have to use a needle to do this because the cannulas are blunt and they wouldn't go in otherwise. Okay, so I've already checked that this is numb, Pam can't feel anything, and we just make a very small incision just to allow us to put the threads in. So these are my blunt threads, and we're going to put 3 on each side of Pam's face. You okay?
Mm-hmm.
Can sometimes be a little bit tough as you're going through the different layers of the skin, especially around this area. So I'm just going to put a little bit of local anaesthetic in. And then we just lift the skin over the thread, and we take the cannula out and leave the thread inside. And it's as easy as that. So I've now inserted all 3 threads into the side of Pam's face, and the next step will be, once I've done the other side, is we lift and we bring the threads up, and we lift and we secure them and cut them off so you don't see anything and you're just left with a small hole. I've now put in 5 of the 6 threads into Pam's face, and I'm just about to insert the last one to give her a really good lower face lift. And we're aiming down here to her jowls to try and lift those. And again, we lift the skin up over the thread, over the cannula, before we lift it out to get a really good lift. So now I'm going to lift the skin over the threads and then tighten them and then trim them off. So I hold on to the threads and we just gently lift the skin up over the threads. This is because the threads are barbed and they attach underneath, and you only get one-way movement. So we lift it up so you get a really nice lift. And you can already see from the front you've got more lift on the one side. Pam, can I just ask you to turn your face? Like the difference, just because I've lifted the skin up, you can already see that she's got a really nice lift on that side. And then now I'm just going to twist this to tighten it, and then we'll just trim them off. So now I've tightened the threads and you can see you've got more lift. We've put some steri strips on just to allow the lift to stay there. Now we leave these on with the dressing for 24 hours, and that allows any swelling from the procedure to settle down and holds the tissues in place. So now I just gently trim the threads off to the bottom of where I've twisted them, and then we just bring the skin over the top and all you're left with is a small needle hole, and I will just put some antibiotic cream on that and a dressing, which again comes off tomorrow. So again, lunchtime facelift, there's no scarring, no bruising, and she goes back to work tomorrow. Nobody knows she's had anything done. So this is Pam all finished. We've put these dressings on, and you can see a little bit of puckering here, but that's not puckering from the threads, that's just where we've pulled her skin extra tight with the steri strips. And when she takes all those off tomorrow, that puckering will just relax, that won't be there. And this is how she goes home this evening, and then tomorrow she takes all of these dressings off and she goes back to work as usual. How are you feeling? How was the procedure?
Yeah, fine. It wasn't painful. It feels quite tight and a little bit sort of sore under there, but nothing too bad.
The soreness here is where we come down, and that's the end of the threads, and that's where they're attached, and that's why you get such good lift, because you're lifting from here, from the jowl area.